Hola a todos, ¿cómo están? Yo soy Carol Perelman y les estoy hablando aquí para Enlace Judío y tengo el honor de estar el día de hoy con Grace Wange, que es una epidemióloga, una doctora y con una especialidad en epidemiología, farmacoepidemiología, y que vive en Yakarta, en Indonesia. Y está aquí con nosotros para hablar un poco sobre la situación en Indonesia, lo que está sucediendo con COVID-19 en Indonesia, ya que estamos viendo un aumento dramático de casos y ya muchos le están llamando el nuevo epicentro de la pandemia de COVID-19. Entonces, bueno, esta entrevista será en inglés. No hablo indonesio, pero podemos comunicarnos, Grace y yo, en inglés. And just before I go, I want to thank Dr. Sandra Lopez Leon, which was the matchmaker, and she enabled this wonderful conversation between you and me. So thank you, Sandra, for letting me talk to Dr. Grace. Thank you very much. And Grace, welcome to Enlace Judío. I am super happy to talk to you tonight for you and this morning for me. And we all want to know why Indonesia? Because you had a very slight, just a bump, not even a wave, I think, in December, no, reporting an average of, reporting the same as we are reporting now in Mexico, which is about 12,000 cases per day. But now you're reporting over 50,000 cases per day, almost 60,000 cases for day. So can you explain a little bit how Indonesia, which is the fourth most populous country in the world, this archipelago, no, these islands in South Asia, how are you managing the pandemic, and why are we seeing this huge peak?
Yes, so I think we call this a second wave. Last December, we do have the first wave, and we still don't know for sure why we have this huge surge number of cases. But a lot of people saying partly it's because of the Delta variants, because we do have a lot of reports of imported cases with Delta variant, and also if we look also the mobilization between areas in Indonesia is like in the beginning of the pandemic, we have this strict restriction about mobilization, but maybe people get a pandemic fatigue, and it's not the case anymore. And actually the rise has already started since we have the last Eid, which is the Muslims day celebrations. And people do, because it's already been a year without going back home. They did that, and the government cannot really have a strict measure to prevent the mobilization. And then we're starting to see the rise of the cases. And also people also say because we have also a lot of migrant workers coming back home because also the same celebration. And they brought the Delta variants, and that's two of the could be the main reason that was told by the government that why we have a lot of cases now.
So let me explain, because what you're saying is very important, because Indonesia is the most populous Muslim country in the world.
Yes.
And so you're saying probably this huge surge is coming after the Eid al-Fitr, right? The holiday?
Yeah, that's correct. The holiday,
the Muslim holiday, okay. And you know, it makes me remember what happened in India, that with the Kumbh Mela, which is the all these celebration, the Hindi celebration also was the beginning probably of that huge wave. So you're saying this was like the trigger, plus the Delta variant getting in. Okay, so what are the guidelines, or what is the government doing? I understand you have even put hospitals in airports. Is that correct?
Yeah, we have the government add extra beds, of course, and now some of the emergency room is actually changing into intensive care unit. So, but still, because we also have a lot of medical care workers are infected, so we do have a lot of beds, but very minimal resource of human resources, especially because this is like high risk, severe cases. They need a special attention, special medical, special skilled workers, special medical skilled workers. So yeah, that's the main issues, I think. Like people are cannot even go to the hospital anymore because they get rejected because we cannot handle them, and a lot of people actually die at home because they were advised to stay at home because maybe in the beginning their symptoms is very mild, but then because they do that without proper medical supervision, they're getting severe and severe without anybody notice, and they're also reluctant to report it to the medical authorities. So some people actually died at home during the isolation, the self-isolation. Yeah.
Okay, okay. And do you have a problem which is similar to our problem in Mexico, which is the lack of testing? Because you are doing almost no testing like we do in Mexico, approximately 58 per 1,000 people, which is what we do in Mexico, which is super low. Can you talk a little bit about that? Because probably the surge is bigger than what we're seeing in Indonesia even.
Well, there's been a lot of critics from a lot of epidemiologists, especially because we have such a low number of testing. But also because the facility is very lacking. I mean, especially the PCR tests, especially in the eastern part of Indonesia, there's not many laboratory can actually perform those tests. Today we have actually higher antigen tests compared to the PCR, which is also a lot of people already criticize that because it shows that even maybe the confirmed diagnosis is even higher. That's what happened. And we've been, I think even the WHO has been telling the government to increase the test, but we don't know what happened. I think it's also because also the facilities, especially in some part of Indonesia, are lacking. I think Jakarta as the capital doesn't really have big issues with testing, but other province, they do have it. So that's the issues. Yeah, but testing, yeah, we still have very low rates.
Very low rate of testing. Yeah. Okay, and what about children? I was reading that more than 550 children have died since the start of the pandemic, but 20, almost 30% of that figure was now during July. Can you say a little bit about that, or what are you thinking on these pediatric?
Yeah, for pediatrics, we don't really have the only data that reported is actually from the central hospital, and the central hospital usually receive very severe cases. So people are still arguing whether that's the correct representative of the children in Indonesia. But nowadays, we do, I mean, like talking to my pediatrician friends, they do see a lot of children getting COVID infection because now a lot of family clusters is happening in Indonesia. So the children are getting infected, but not really severe. They can still, treat it at home with their parents. But yeah, so I don't really see the data that we really need the, like intensive care unit for children, but there's, of course, because we are such a high number of population, there should be a lot of children also affected by this pandemic.
Yes, so Indonesia has 270
million.
Million people. So it's the fourth most populous country in the world. And also, can you explain a little bit about what is the guidelines now in Indonesia? Is there a lockdown, or what is the government suggesting? The use of masks? So more or less, what is the message?
Since the beginning, I think the government already suggests us to use masks, and recently they even promoting of using double mask, two masks together, and it's a common, like even the presidents promote that, but the implementation is another thing. People use masks, but not correctly. Most of the time, just like their nose is still exposed, something like that. And nobody is actually, like telling them to correct their position of their mask. I mean, like we do that in the beginning, but nowadays people are just like, okay, I don't care about how you use mask as long as I use mine correctly, something like
Exactly.
that. Yeah, but it's actually implemented, and also like vaccination. We already have. We try to increase the number of vaccination rate, but it's still vaccination is actually a bit difficult because especially for old generations, there's a lot of disinformation and hoaxes, especially about the side effects of the vaccines. So a lot of people are still scared to get vaccinated. And that also the distribution to to the very to the eastern part of Indonesia, to the rural part of Indonesia is still difficult. But in Jakarta, the rate and everything is going well. But now we get, I mean, like I think today we also see that the number in Jakarta is getting lower. But in other provinces, especially the eastern part of Indonesia, they're getting higher, and it's really worrying because they even have lower they have they have worse facilities, right? So less doctors. So yeah.
I remember something in September that people that wouldn't want to wear masks, can you explain a little bit about what happened, or what was the punishment for not wearing masks in September in Indonesia? I understand that they had, okay, you explain it.
Yeah, I think in the beginning we have those kind of things. So if you don't wear masks on the street, you get this like social punishment. So you need to swap the street or doing some exercise.
Or bury, you have to be one of the barriers, no? I saw in the news.
Or bury, yeah. There's a lot of things people get. I mean, like the officer getting creative of that, but it's not no longer the
no
case.
longer
I think.
active. Okay.
Yeah, because it's not really giving any impact. People are still.
And what about ventilation and measuring carbon dioxide or something? No guidelines on opening windows and being outside and trying to.
There are guidelines for that, like how you need to keep your ventilation open and cleaning your room frequently. And then just how many people should be in one room at the same time. There's guidelines for that, but not really like measuring the carbon monoxide.
No. Okay. And so a little bit about vaccination, because you are using a vaccine that I remember at the beginning you were hesitant to start using because people were not sure if it was halal. And this is the Sinovac vaccine from China. And that's exactly one of the vaccines we're also receiving here in Mexico, Sinovac. And with Sinovac, you have administered at least one dose to 15% of the population, which is very, it's good, but it's still low, not compared to other countries. And that's why probably Delta is making this huge surge. So how is the rollout? And also, is there any messaging or any kind of idea of probably requiring other kind of vaccines, or is Sinovac really, because I understand there are some medical doctors, as you say, that they have been, they received Sinovac, and 20 doctors that died after receiving, not because of the vaccine, but obviously because of COVID, getting COVID, being already vaccinated.
Yes, so the first vaccine that we had is indeed Sinovac, and I think the issue of halal is not. This is not the first time. Every time we have vaccination, we have the issue of halal. And I think the government already did the good things this time. So they released the emergency use authorization together with the halal certificate. So there should be no issue about the halal of the Sinovac. But then they have the issue of this is a Chinese vaccine. Yeah, that's always the case. The first batch who received the vaccine is actually the healthcare workers. So I get the first batch also because I'm a healthcare worker. And at the first time we hesitate, but we do have the clinical trials run in Indonesia. And the results shows that the efficacy about 63% among Indonesian populations. And then at that time, we only have those vaccine. And then the doctors are like, this is the best that we can have. So just have it, right? The best vaccine is the available vaccine, right? And then after that, we get AstraZeneca vaccine. And then the issue with AstraZeneca vaccine is actually the side effects. People heard there is a case where this young guy was vaccinated and then he died. It was later said it was not related, but then people become really scared about the side effects, and then they think of, oh, maybe we should wait for the other vaccine, Pfizer or something like, or Moderna or whatever vaccine that come after this, because we don't really trust the Sinovac, but then we afraid of the side effects. So that's the thing that we need to clarify every time with the people who doesn't really want to be vaccinated. But so far we only have Sinovac and AstraZeneca. There's another vaccine called Sinopharm from CanSino, also from China, but it only being given to certain group of people because we have two schemes of vaccine. First is from the government, and the second one is it's kind of private, but like some of the industrial, for some of the company, they kind of buy their own vaccine, but they need to give it for free for their employee. So some very small percent of Indonesian get the Sinopharm.
So that's different than what we have in many countries in the Western world, which is that private companies can buy vaccines then in Indonesia and administer it for free to their employees. Is that correct?
But only certain vaccines. So only the one that is not used by the government for the free vaccination program.
Okay, I understand. Very interesting. And talking about misinformation, I heard that there is some rumor going on about that milk creates antibodies, which is one of the huge misinformation as things that is going on there. Can you talk about that a little bit?
Well, there's a lot of cases like that. Like the milk, I think the last case is like we have this milk with certain brand. I don't know who started the rumor, but then people starting to buy that milk because they think it will prevent them from getting COVID. So it's more like panic buying.
Yes.
So it's not just milk. There's also another like herbal medicine getting bought. Sometimes I don't keep up anymore what kind of things that people buy.
You know,
from
there is this big infodemic, and I couldn't believe, well, that's misinformation, but I couldn't believe that was a milk. I mean, an actual milk, thinking that milk was providing antibodies. I think
but I think that's okay, right? I mean, like if they get the milk, it's also fine. Yes. But we have even worst case where some drugs was claimed to help prevent them to get infected, and the drug is actually is quite toxic. It's drug for parasitic infection, but then it was like informed as one of the drugs that can help them cure the infection. And then people are also doing a panic buying because in Indonesia, even though you need a doctor's prescription, but still you can buy through the pharmacy some of those drugs, or some antibiotics even like lacking from the pharmacy because people are keeping them at home. So that's bad, I think. I mean, like if they want to buy the milk, I'm fine with that. But then this is drugs.
Yes,
The side
I
effects we don't
think
know.
you're talking about the same drug that they are using also in Mexico without evidence that it's a real treatment for COVID-19, which is probably ivermectin. Are you talking about?
Yeah, that's why.
Yes, so we have the same disinformation in Mexico, exactly the same one, Grace. I think we're all the same human race. Grace, and anything else you want to add to understand the problematic of the situation in Indonesia? Are you at home? Are you going out to work, or you're working online yourself?
I'm not working online. Like I think last month I'm still helping with the vaccination center. With a bit worried, we start using hand gloves and double masks and all of this PPE, because even like during the vaccination, some people are actually get symptoms and they still go for the vaccination. But the thing that's worrying for me personally now is I see a lot of pregnant women get infected and then they die with the baby. That's the thing that's really sad for us. I mean, like I don't know the exact number, but there's a lot of reported cases that a lot of pregnant women are getting infected. They have to deliver by cesarean, and I think there's been a recommendation of also vaccinated these women, because yeah, it's so sad to see a lot of pregnant women die with their babies. I mean, like families just suddenly just 4 or 3 families because just only one single person in the family. I think maybe I don't know whether that same thing happened in Mexico also, or
they started to offer vaccines to pregnant women in Mexico.
Oh, that's good. That's good.
Yes.
Yeah.
Yes.
Here
yes.
is still under discussion. So I was like, why?
Yes, I think the benefit of pregnant women getting a vaccine is much higher than the slightest risk.
The risk, yeah.
Yes. Yeah. So yes, I do encourage women to get vaccinated, and in Mexico, women are getting vaccinated.
Oh,
we have several vaccines in Mexico. We have Sinovac, we have AstraZeneca, but we also have Pfizer, we also have Sputnik, we have CanSino. We have a whole array of vaccines in Mexico. But yes, pregnant women in Mexico can get a vaccine. So I think that's something good. But we also have a surge in Mexico currently. We're calling it a third wave. We didn't really finish the second wave, but this is a huge wave, and hopefully we'll manage, and hopefully we won't get the medical system saturated like in the second wave. But what we are seeing in Indonesia is very worrisome, because if you see the graph, it's really just going up.
Yeah, without that.
What about oxygen supply?
It was rare in the beginning, and now we see also report outside Jakarta. I mean, like in Jakarta, we don't really. I mean, like it was lacking in the beginning, but it was handled quite fast. But outside Jakarta, we still see report of lacking of oxygen. But I think we already get help from other countries. They're sending their oxygen concentrators, but then the issue is how to deliver it to the other part of Indonesia. I feel like in Papua, I already see reports, and that's quite far and difficult to reach.
Because I understand Java and Bali, right, are the most cases are in Bali and in Java.
Yeah, but the most reported.
The most reported also. That's
I don't know.
That's correct. Probably the figures are bigger, and I hope soon you can stabilize and start lowering the cases, and then and keep on the rollout, and be safe, Grace. And I hope you can give lots of vaccines and protect more people every day.
Thank you. Stay safe also for you. Yeah.
Thank you. Anything else you want to add? Anything we didn't discuss, but do you think it's important?
No, at the moment. I think every country already faced the same issues. Yeah. Now we're not really special. I mean, like, because people say, Indonesia is so big. There's a lot of islands. So that's why it's more difficult to retain this infection. But I think every country have the same difficulty. So it's not the matter of the whether we are huge, we are overpopulated, but it's a matter of how you can get the correct strategy to handle this.
Yeah. Yes, and it's very interesting what you talked in the beginning, how religious gatherings and festivities can really let, after all, it's us people getting the virus from one people to another. So
yeah,
that's
the key.
Well, Grace, take care. Good night to you.
Too,
it's very late in Jakarta now, so thank you for taking my invitation at this early hour for me, but late hour for you. Have a nice night.
No problem. Yeah, you too. Have a nice day.
And thank you very much.
Yeah.
Be safe.
Bye-bye.
Bye-bye.